thing can happen when the awareness is there, and I think there comes a lot of work which Ms. Nilanjana Moulik is doing. Nilanjana is there. She's the the Secretary General of Alzheimer's and Related Disorders Society of India. ADRSI has been doing a lot of pioneer work, and they do a lot of good events, and Nilanjana is very, very helpful. Whenever we tell Nilanjana we need to do this, that she's always very enthusiastic, and whenever possible she has been such. And caregivers, they play a very, very critical role. So your thoughts on that aspect as well. So over to you. And I think when you talk, I think we need to press this button. I think.
No, we are doing it, but it's going off.
Oh, I think it's for a few minutes and again,
yeah. Yeah, it's working, but I believe me, it's going to go off in seconds. So very good afternoon to all of you. Namaskar সকলকে অনেক অনেক ধন্যবাদ ইনফিনিটি এবং অনিন্দকে এবং অনিন্দ টিমকে টু ইনভাইট মি। আই এম রিয়েলি সরি, সিনসিয়ারলি সরি আমার আসতে দেরি হয়েছে। ওয়ান বিকজ I had a patient family who was visiting from Mirzapur, and they took 4 hours to come, and I just couldn't deny them the opportunity to talk to me. So that was one of the reasons. So I started late, and then of course the roads are to blame. But I sincerely apologize. Coming back to your question, yes, myself, I have been into this dementia care space for the last 30 years. In Kolkata, last 25 years. And I remember the first awareness that I did on dementia, the condition as well as the care that revolves around dementia. I had 2 people attending the awareness session, and this was 1999, September. And at that time, the awareness was extremely low. And so people really did not want to come and listen to a topic that was not affecting them, basically. So it hasn't happened at my doorstep, so why should I want to come and listen to this? I think 10 years down the road, I have been to big organizations where they are much aware of the condition, and I still face challenges as to them allowing us to talk about what dementia is and the warning signs that Dr. Anand was talking about. So from 99 till 2024, a lot has changed in terms of awareness. People have at least heard the word dementia, even though it is not very, very clear, because if you really see the World Health Organization statistics, it clearly says that 2 out of 3 people have very, very vague knowledge about dementia, and every 3 seconds somebody is developing dementia. So the statistics itself says that we have a lot to do, but we haven't reached anywhere near. So I think there has been an increase of understanding, especially the medical professionals, because we also see, because families come to us, and we see there are a lot of medical professionals also who would have told the family, চিন্তা করবেন না, এটা বয়স হয়েছে, ভুলভ্রান্তি হয়, কাজেই বাড়ি যান, চিন্তা করবেন না। And therefore, the diagnosis has been delayed and the help has been denied. So what we see is a huge jump of understanding among the healthcare professionals, whether it's the doctors, the nurses. They understand very clearly, and therefore they are able to guide the family members well. But then there are few, I would say 3 areas where the challenges still persist. Number 1 is general awareness about brain health. You are always worried about the rest of your body except your brain, because we are not really worried about what the brain is helping us to do every moment. So brain health awareness is very low in not just in India, it's anywhere in the world, but I think more so here. And the second one is, of course, the infrastructure regarding care and access to care. So we have seen family members after the diagnosis of dementia in the doctor's chamber leaves with just one white piece of paper where the diagnosis has been written and there is no other guidance. Obviously, because the doctor doesn't have much time to really explain what's going to be the next way forward. But the access to care is limited there because the doctor is not really then telling the family members that, well, you know, the medical intervention has been done, the non-medical intervention has to be taken up by, you know, organizations that are working for this or professionals who understand what should be the care pathway. So I think that access to care is a huge challenge. So we have been working, like I said, 25 years. About 60% of referrals come from doctors these days to us, which we would not even imagine 20 years back. But after maybe several visits to the doctor, the family is told about us. So by the time the family understands what the importance of the caregiving aspect is of dementia care, a lot has been compromised in between, you know, that time. I just had a family visiting me yesterday, and I was talking to her. She is in her late 70s. Her husband is in his early 80s. Husband comes to our daycare center where he spends a meaningful time. The wife has heart diseases and she has been hospitalized at least 10 times for the last 6 months. And she had a recent attack and she wanted her husband to kind of help her with her back that was really painful. And she said to him, "Can you help massage my back?" And he had no understanding of what he needed to do. So I think the family caregivers, for that matter, even professional like me, who has been trained in dementia care, needs a lot of training, counseling, and a guideline as to how they will really walk that journey. Because looking at the prescription, it says